So as I mentioned before, mindfulness with a small m is concentrating our mind, focusing our minds, which we call concentration or focused meditation or shamatha. And this is something that we often do sitting down, either in a chair or on a cushion, but it can be done walking. If we do it walking, it's a very, very, very slow walk with very short steps. And I'm not going to go into that now. We don't really have the time, but there's an instructional video on our website, Altruism and Medicine Institute website, if you're interested. So the benefit of practicing concentration meditation is, number one, it reduces some of the chatter, the clutter in our minds. It develops more of a calm mind. It allows us more perspective because we have less of that junk blocking the mind. And because of calmness, less clutter, and more perspective, we can make better decisions. So young people some young people have found some of this research showing that doing some meditation before an exam can enhance your performance. So they do it. Athletes, particularly professional or collegiate athletes, many of them now are bringing meditation into their sport and into their life. People in business want to make better decisions. So we do many programs with small and even large, very large business groups who want to learn this. It helps our physical and our mental health. It helps strengthen our immune system. It helps strengthen our cardiovascular system, less heart attack, less stroke. It helps to strengthen our respiratory system, less things like asthma and some other respiratory illnesses. It's helpful for anxiety, for reducing anxiety, reducing fear. It's helpful in reducing depression and sometimes for post-traumatic stress syndrome. So it has many health benefits, physical as well as mental, emotional health benefits. So let's jump into a meditation, okay? We'll do it for 5 or max 10 minutes, and I will kind of get you started. So I want you first to please, so before we do that, I just want to mention that object of our meditation, our concentration meditation, can be several. One can be the breath. That's the most commonly used object of our shamatha or concentration meditation. 2, it can be an image of the Buddha or even of another, religious figure, Jesus Christ or someone else, or even non-religious, someone we deeply feel connected to as a kind of the mentor. It could be, for example, Albert Einstein, who fills that role for me sometimes as a mentor. And thirdly, it could be the mind itself. And that's something a little more, it's not as easy for most people, but the essential qualities of mind, which are awareness and clarity. So being present with awareness and clarity of the mind is a third potential, I put in brackets, object of our concentration meditation. So we're going to do a meditation from the first of these, that is the breath. And we're going to observe the breath here at the base of the nose. And we're not going to follow the breath in and out, but rather we're going to focus our attention, our awareness, excuse me, at the base of the nose. And if we notice the sensation of our air passing at that place, then we concentrate on that sensation of the air passing at that place. If we don't, then you just focus your attention at that place, okay? So that's what we're going to do. We most likely will get distracted, and maybe many times. So when you get distracted, first notice that you're distracted, and then bring your mind back to this place here, either the sensation of the air passing there or that place. And actually, when you do that, you recognize you're distracted, bring your mind back to here. That is actually meditation. That is the training of your mind to be less distracted. Good. So I would like you please to sit up straight. If we keep our spine straight, we have these very subtle energetic channels and chakras that run in front of our spine, and it keeps them straight without being kinked, which is what we want to do to be healthy. Our head will be straight up, not back, not forward, but straight up, and our eyes will be open. Now the eyes will be glancing down like this with mouth closed. And we'll breathe just normally. So we don't force our breathing. Breathe normally through our nose. Concentrate our attention there, the base of the nose. And again, if you notice that air passing, that sensation at that place, then you keep focusing your mind on that. If not, just focus your mind on that place where the nose and the upper lip kind of meet. If you like, you can put your hands with your left palm up and your right palm up on top, and the thumbs making a triangle, and you rest that in your lap and relax your shoulders. If not, just gently rest your hands in your lap. Now, with your eyes open, try not to stare at whatever's in front of you, whatever is in your visual field. Maybe your laptop, keyboard, or the desk, or wherever you are. Try not to stare at it. So we call that a soft gaze. Sometimes that takes some practice, doesn't come right away. Do the best you can. Good. So please meditate. I will take care of the time. We'll do it for approximately 5 to 7 minutes. Please meditate. If a thought comes up, if a sensation in your body comes up, a noise or something that you're staring at with your eyes open, recognize that's distraction and come back to focusing at the base of the nose. please stop your meditation. It's important that you not judge your meditation or yourself as the meditator. You know, I'm so good. This meditation was just incredible, so awesome. Or I'm terrible, I can never do this. Or that was a disaster. Try to avoid the temptation for that kind of judgment, your meditation session or yourself as the meditator. Good. So I think we have time for a few more questions, and then we'll leave a little time at the end for our wrap up.
Sure. We've got one technical question about meditation, and just asking if it's okay to do it lying down.
It is. It's better to be sitting up. If you do lie down, be careful not to fall asleep or to get dull. But you can do it lying down. Preferably, it's when it's to be sitting up.
And I have another one that's,
why do you keep your eyes open?
Keeping the eyes open over time helps us develop more mental clarity. So that's the reason for keeping our eyes open.
I have a kind of a question reviewing some of the, or referring to some of the content previous, just asking if compassion is the opposite of anger, what is the opposite of jealousy?
The opposite of jealousy is appreciation. So when we're jealous, you know, we kind of don't want good things to happen to the person we're jealous towards. Whereas the opposite would be we want good things to happen. So being appreciative of whatever happened that was positive in their life, then would be the opposite of jealousy.
And people saying they find it difficult to do with their eyes open.
Yeah, you can meditate with your eyes closed if you just can't do it with the eyes open. It's okay. It's better to meditate with your eyes closed than to not meditate.
Someone says, you mentioned outlook and attitude at the outset today. I think that our outlook and attitude can sometimes be changed, like throwing a light switch. Would you agree to that?
Definitely. And hopefully it's towards the positive, towards concern for the welfare of others.
Someone also says that they started to feel tears during their meditation very early. What are your thoughts on that?
Wonderful. Try not to be too attached to them. Try not to push them away. Just let it be.
How do you define resilience? Is it more nature or nurture or a mixture of the both?
I guess it's a mixture of both. It definitely is something that can be trained. And I think the things that we talked about today, mindfulness, compassion, these are the ingredients giving rise to enhanced resilience.
What about circumstances that are very hurtful and bring a lot of anger? An example is divorce. With that creating recurring anger, how do you best address that?
Difficult. That's very difficult because those are so emotionally charged, or can be so emotionally charged situations, divorce. You know, to try to remember all the different aspects of the other person, not just the stuff that got under your skin and, you know, had to do with the divorce and the anger, stuff that brings up anger, but try to remember, you know, this is a person, the other person has many different facets. not just the one that creates the anger or may have led to the divorce. I think that's helpful. Also to recognize that divorce is, most of the time a two-way street, even if it's one person that says, I'm out of here. Usually it's something that's going on with both people, to try to recognize that. So to take, in a sense, that responsibility, but also not to make that responsibility guilt. It's not that that's not healthy to feel guilty, but in a more mature way to feel that, okay, I'm partially responsible for this relationship not working out, at least on a marriage level. And then, with time, hopefully, when things, some of that real strong hurt and anger calms down some, hopefully that you can come back to some kind of a friendship with that other person, or at least, try to have that as a possibility, I think is also helpful.
Got another technical question about meditation. It says, is the goal of meditation to clear the mind or to address thoughts that are coming up?
Yeah, so remember I mentioned there's two major types of meditation. One is the one we did, concentration meditation. And in that one, anything that's other than focusing here at the base of the nose would be considered a distraction. So that would include thoughts. So we wouldn't want to push them away, but rather we'd want to come back to our chosen object, the base of the nose, watching the breath. In the other kind of meditation, analytic or contemplative, there we often use thought to try to develop a certain experience, maybe of compassion, maybe of wisdom, maybe of patience. So there we would use the thought, not any thought, but thoughts that are that are helpful. We learn how to approach the thinking to cultivate, for example, compassion or love or patience or wisdom.
I think we've got maybe one more that says, I still struggle with how to help my nurses work through their grief, sadness, anger, or anger about the losses sustained over the last year. How do I help? So it's how to help.
Sorry, the first part of the question was, yes, what to help?
I still struggle with how to help my nurses work through their grief, sadness, and anger about the losses sustained over the last year. How do I help?
Yeah, I think to be an active listener goes a long way when there's time for that, just to sit down. If you, either at, the hospital or the clinic, or maybe sometimes in another place, to sit down and just to have a half an hour or longer and just kind of talk, and everyone try to share their experiences. It may involve a lot of pain and crying, and I think that's really healthy to do that. I mean, obviously on a volunteer basis. It's not easy what we've been through, and particularly the frontline nurses and doctors and others on the front line has been horrific. So it's not something that's going to be fixed right away. So if we have that expectation, that's unrealistic, I believe. And the things that we've talked about today are wonderful things to begin to bring in to your healthcare communities. As I mentioned, Altruism in Medicine has been doing extensive work with 18,000 nurses. Maybe I didn't mention it, with 18,000 nurses at the University of Pittsburgh Medical Center, UPMC, on just these things. So and recognize this is going to be an ongoing situation probably for some time. So not just to drop that wish and that action of trying to work with all this intense trauma.